Nighttime leg cramps? Fix them with these 3 vitamins. Imagine waking up in the middle of the night, your leg suddenly seizing with a sharp, twisting cramp that feels like it came out of nowhere. You gasp, tense up, try to stretch it out, but the pain lingers and sleep feels miles away. No more of that. No more waking up in agony. No more rubbing your calves in the dark, hoping the cramp doesn't return. If you're tired of those sleepless nights and sore mornings, here's the truth. Your body might just be missing 3 essential vitamins. At Golden Health 365, we believe staying strong, steady, and independent doesn't have to be complicated. And today, we're revealing the 3 most powerful nutrients that can stop nighttime leg cramps before they start, while also strengthening your muscles, improving nerve function, and helping you walk, stretch, and rest with confidence. These aren't magic pills. They're science-backed, body-ready vitamins that fuel your legs from the inside out. Whether you want to enjoy peaceful sleep, get back to walking with ease, or simply stop worrying about those sudden jolts at night, this video is for you. Before we begin, drop a comment and let us know where you're watching from. We love hearing from our community. And if you have any questions about leg health, muscle function, or senior-friendly nutrition, feel free to ask below. Don't forget to hit subscribe and turn on notifications so you never miss out on our practical, research-based tips here at Golden Health 365. Let's take the first step together towards stronger legs and deeper sleep, starting right now. So let's begin with the one mineral most people overlook, yet it plays a silent but powerful role in how your legs feel every night. Magnesium. They call it the sleep mineral, and for good reason. Magnesium is one of the most important nutrients your body needs for smooth, restful muscle movement. Every time your leg flexes, stretches, or relaxes, magnesium is there behind the scenes, making sure those nerves and muscles communicate clearly. But here's the problem. As we age, magnesium levels often decline. Many seniors lose magnesium due to stress, medications like diuretics or acid blockers, and even poor absorption. And when that happens, the effects show up in one very painful place: your legs, leg cramps, tightness, spasms that wake you up just as you're falling asleep. Does that sound familiar? Clara, 79, used to cry every night from these episodes. She told me, "I thought it was just my age. But then I started taking magnesium glycinate, and now I sleep through the night." Her story isn't unique. Studies have shown that low magnesium levels can lead to overactive nerve signals and involuntary muscle contractions. That's why magnesium deficiency is closely linked with restless leg syndrome and nighttime muscle cramps in older adults. But let's be honest, magnesium isn't a miracle pill. In fact, a 2021 clinical trial published in the Nutrition Journal tested magnesium oxide in older adults with chronic leg cramps. The result? It didn't significantly outperform a placebo. So what does that mean? It means that magnesium alone may not solve the problem for everyone. But for many people like Clara, when combined with better hydration, light movement, and other supportive vitamins, it becomes part of a holistic, gentle solution that actually works. Here's what makes magnesium special. It calms the electrical chatter in your nervous system. It helps your leg muscles relax fully after they contract. And it supports steady circulation, especially to your lower limbs, throughout the night. So where can you get it? Food first. Pumpkin seeds, black beans, spinach, almonds, and avocados are all magnesium-rich staples. If you can include just one of these foods at lunch or dinner, you're already helping your legs. But if you need more consistent support, supplements can help. Not all forms are created equal. Magnesium glycinate is gentle on digestion and absorbs better than magnesium oxide, which often causes stomach upset. Most older adults do well with 200 to 400 milligrams daily, ideally taken at bedtime. But always check with your doctor before starting anything new, especially if you have kidney issues or are on multiple prescriptions. Now, if you're thinking, I've tried magnesium before and it didn't work, you're not alone. Many seniors need a combination of nutrients to truly feel relief. Because cramps aren't just about your muscles. Sometimes the deeper issue lies in your nerves, how they send signals, how fast they respond, how well they recover overnight. And that brings us to the second vitamin. It's not something you eat. It's something your body makes with a little help from the sun. Could sunlight actually protect your legs at night? It might sound strange, but vitamin D, produced naturally when sunlight hits your skin, plays a critical role in keeping your leg muscles calm, steady, and responsive. For seniors, this vitamin is often quietly missing. That's because as we age, our skin becomes less efficient at producing vitamin D. We also spend more time indoors, add long sleeves, sunscreen, and mobility issues. And what do you get? A slow, silent deficiency that weakens your legs from the inside out. What does that look like? Unsteady walking, slower reflexes, muscles that feel off, even though you're trying your best. You may think it's just aging, but the truth is, your muscles rely on vitamin D for something essential: neuromuscular control. Vitamin D doesn't just help with calcium, it helps your nerves send signals to your muscles, especially the fast-twitch fibers in your legs that prevent falls and keep your balance when you shift in bed or get up from a chair. A large meta-analysis published in Frontiers in Endocrinology, 2024, found that active forms of vitamin D, like calcitriol and alpha-calcidol, can reduce fall risk by nearly 19% and significantly improve quadriceps strength in older adults. That's not hype. That's data. When your vitamin D levels are low, your legs don't just weaken. They misfire. They cramp. And your chance of injury, especially from nighttime trips to the bathroom or sudden movements, increases dramatically. Clara once told me, "Nobody ever said my cramps were a vitamin D issue. I only found out after a blood test." She's right. This deficiency often flies under the radar until the symptoms become impossible to ignore. So what can you do? Start with gentle sun exposure. Just 10 to 20 minutes of morning sunlight on your arms and legs can stimulate natural vitamin D production. Avoid peak UV hours and don't stay out long, but even this small step helps. Next, add D-rich foods like salmon, fortified milk, egg yolks, and mushrooms to your weekly meals. And finally, talk to your doctor about a supplement. Most seniors benefit from 800 to 1,000 IU per day, especially in winter or if they're rarely outdoors. Vitamin D3, cholecalciferol, is the most recommended form, and it absorbs best when taken with a meal containing fat. But don't just take vitamin D blindly. Ask your doctor for a blood test. You might be shocked to learn how low your levels are. And if you're already dealing with muscle pain, poor balance, or a history of falls, correcting this one number can make a world of difference. Now, maybe you're already getting enough sun. Maybe you've tried magnesium, and you're still waking up at night, wondering why your legs won't cooperate. The missing piece may not be in your muscles at all. It could be in your nerves, the cables that carry every signal from your brain to your legs. And that's where vitamin B12 enters the picture. If your legs feel heavy or unresponsive, your nerves might be starving. Vitamin B12 is often overlooked when people talk about muscle pain or leg cramps. But for older adults, it may be the most important vitamin of all. Why? Because B12 doesn't just support energy, it protects nerve health. Every time your brain tells your legs to move, stand, or stretch, that signal has to travel down your spine and into your muscles. Without enough B12, that signal gets weak. It slows down. Sometimes it doesn't get there at all. And the result? Your legs might feel tired, unstable, or disconnected, like they're not responding the way they used to. Some people describe it as walking through water. Others feel tingling, burning, or numbness that keeps them awake at night. Emily, 76, said it best. "I thought I was losing control of my body. My legs just wouldn't listen." Her B12 levels were critically low. This is more common than most people realize. Unlike other vitamins, B12 isn't well absorbed with age. Seniors often produce less stomach acid, which is needed to release B12 from food. Add common medications like metformin, acid reducers, or blood pressure pills, and absorption drops even further. The scary part? B12 deficiency can sneak up slowly. You might not notice the changes right away. A little imbalance here, a little fatigue there. But over time, it can lead to irreversible nerve damage, even when blood tests are borderline normal. Fortunately, correcting it can be life-changing. One study in the Journal of Neurology found that seniors with B12 supplementation experienced significant improvements in gait speed, leg strength, and balance, especially those with prior nerve-related symptoms. So how do you get more? Start with food. Some of the best sources of B12 include clams and shellfish, beef liver, eggs, dairy, fortified cereals. But here's the truth. Many older adults can't get enough from food alone. If your stomach isn't absorbing well, or if your symptoms are already showing, you may need a supplement. The safest and most effective option: sublingual B12 under the tongue, or monthly injections under your doctor's guidance. B12 fouls is water-soluble, meaning your body flushes out any extra. That makes it one of the safest vitamins to supplement, especially when taken at appropriate doses. Most seniors benefit from 500 to 1,000 mcg daily if they have symptoms or documented deficiency. But again, it starts with a simple test. Ask your doctor to check your B12 levels. Don't guess, check. So now we've talked about magnesium for muscle relaxation, vitamin D for strength and coordination, and B12 for nerve clarity and control. But how do you bring it all together? How do you turn this into a routine that fits your life without adding more confusion, pills, or guesswork? Let's build a daily rhythm that supports your legs naturally. You don't need a new life, just a new rhythm. Most seniors I meet don't want more pills. They want clarity, a daily rhythm they can follow that actually works. Here's a simple, low-stress routine to support your legs from sunrise to sleep. Morning. Start your day with 10 to 20 minutes of gentle sunlight. Sit by a window or take a slow walk outside. This boosts your vitamin D naturally and lifts your mood. Lunch. Focus on leafy greens, lean protein, and magnesium-rich foods like black beans or almonds. If you enjoy salmon or eggs, even better. Those bring vitamin D and B12 to the table. Evening. Try a warm foot soak or light stretching. Then take your magnesium, glycinate is best, about 30 minutes before bed. Before sleep, keep your room calm. No screens, just you, your breath, and the feeling of quiet muscles ready for deep rest. Do this for 7 days. Track how your legs feel. And remember, consistency, not complexity, is the key to long-term relief. So, what did we learn? Magnesium calms the cramps. Vitamin D strengthens your legs and balance. And B12 keeps your nerves firing on time. Clara now sleeps through the night. No more tears, no more twisting pain. Just rest. You deserve that too. If this video helped you understand what might be behind your nighttime leg cramps, leave a comment below. Tell us what you're experiencing or what's worked for you. We read every message, and your story might help someone else feel less alone. And don't forget to subscribe and turn on notifications so you never miss our science-based tips here at Golden Health 365. Until next time, stay steady, sleep deeply, and take care of those legs. You need them more than you think.